This is Dr. Carl Garbus from the AOA Vision Rehabilitation Committee. Today we're going to speak about lens prescribing for patients that have had concussion or brain injury. These patients are very sensitive to light, sound, and movement. When they are most comfortable, it is in a quiet environment. Single vision lenses work best. Single vision for distance, single vision for reading, and a single vision sunglass. Patients do not do well with progressive lenses. We stay away from progressives, and the patients who are currently in progressives are very disoriented and uncomfortable walking in those lenses. Single vision makes it much easier to cope with the environment. If you need more information on this, please contact the AOA Vision Rehabilitation Committee, and we'll be happy to answer your questions. You might be wondering what these little areas of occlusion are on my glasses. Well, we use these for patients who've had concussion, brain injury, and are very sensitive to light and sound. These are called binasals or binasal occlusion. They've been used for a number of years with neurooptometry. Patients who have these oftentimes will report that it's easier for them to get around in noisy and busy environments such as the market. The way these binasals work is it allows for the patient to process more information on the peripheral side and blocking out some of the light that's bothering them. Oftentimes there's a convergence issue. They have trouble with binocular vision, and this will actually slow down or limit the amount of noise that's getting into the visual system. They become very useful tools. Consider this when you're seeing a patient who's had a concussion. If it works, they'll tell you immediately that they feel better. If it's uncomfortable to them, you might want to trim down the occlusion a little bit to make it thinner. Let them wear it a while, and you'll see that they feel that they're more grounded when they're walking. Try binasal occlusions. If you have any questions about this, please contact the AOA Vision Rehabilitation Committee, and we'll be happy to help.